titled Navigating ADHD from Questions to Competence. And it is going to be presented by Groves Learning Center leaders Alaa, Houri, Catherine Levis, and Meghan Miller. First, I would like to introduce myself and provide information about some upcoming events for families to engage with Groves, and then I'll review a few housekeeping items and introduce our presenters. My name is Linda Roslansky, and I'm the Director of Outreach here at Groves Learning Organization. I have the great pleasure of working alongside our Learning Center and admissions teams. We have many events to engage with Groves and explore our Academy and Learning Center. Our first open house of the school year will be on November 12th, where you can meet our new head of school, Jessie Coyle, hear from parents and students, and get a tour of our school. We have current openings in some of our Learning Center services like diagnostics and tutoring, and have multiple Glow Ed series events coming up as well, including an experienced dyslexia simulation event and a parent workshop where we'll have multiple breakout sessions from local experts. Please check out our website for more information and registration links. To help us stay on schedule, your camera and microphone have been turned off. This will be an interactive presentation. You will notice conversation chat bubbles at the top of your screen. Please click those to submit your responses and questions, and I will help moderate the questions at the end. Now, it is my honor to introduce our expert presenters. Alaa Houri is a licensed psychologist and the Director of Diagnostics. She received her doctorate degree in educational psychology at the University of Minnesota and leads a team of psychologists in the diagnostic department here at Groves. Catherine Levis is a speech-language pathologist and ADHD and executive functioning coach. She earned degrees at the University of Wisconsin-Madison and Rush University and currently leads our team of 9 ADHD and executive functioning coaches at Groves. Meghan Miller is the Director of Learning Center Individualized Programs, which includes leading the tutoring, summer, and speech-language programs at Groves. She earned her degrees at the University of Wisconsin-Madison and her master's from St. Cloud State University. Take it away, Alaa, Catherine, and Meghan, and thanks again for presenting.
Hi, everybody. Thanks so much for joining us today. We're really glad that you're here. We are here to support those of you that are maybe thinking you're seeing some signs in a student or your own child of ADHD, but you're not quite sure, should you seek an assessment? So we're going to talk about when to seek an assessment, how to recognize signs of ADHD, and knowing when it might be time to schedule an evaluation. We're also going to talk about the different types of evaluations that are available to you and the difference between screenings, comprehensive evaluations, assessments at school versus private, and what do those offer you. And then we're also going to try and give you as much practical and proactive advice as we can in this short time about how to support students who might be having some executive functioning challenges related to ADHD as you're navigating that kind of diagnostic process. Before we get started, I would love to hear from you in the chat who you are. Are you a parent? Are you a professional? Are you here as an advocate? What does that look like? So take a moment if you can and type into the chat. Tell us who you are. And I'll give people a moment to do that. And then I would also love to have you take a moment to type into the chat the first word or phrase that comes to mind when you think of ADHD. So we would love to know who you are and what's the first word or phrase that comes to mind when you think of ADHD. I'm seeing hyper. I'm seeing distracted easily. Definitely. I'm going to wait till we have a couple more. I see some people are typing. Looks like we've got mostly parents here, one parent who's here as a parent and also works in an LD school. And a few more joining us now, so that's great. We've got a tutor here who works with students with ADHD. Thank you all. This is really helpful to know who's here with us today. So some of the words that people are submitting are hyper, distracted easily, chatty, tough to manage emotions. That's a great one as well. Fidgety, yes, definitely. So we're going to talk through, there are actually 3 different kinds of ADHD. And many times what people think of when they first think of ADHD is this hyperactive impulsive presentation, which is what a lot of you were naming characteristics of. Fidgety, restless, leaves their seat a lot, talks excessively, blurts, hyper, often interrupts or intrudes. These are all symptoms of the hyperactive impulsive type of ADHD. In order to be diagnosed with the hyperactive impulsive type of ADHD, for kids, we need to be seeing 6 or more of these symptoms. Then for adults, we need to be seeing 5 or more of these symptoms. And so when we're talking through these different types of ADHD and the types of characteristics that you might be observing, we need to be thinking about, is it just 1 or 2 of these things? Is it showing up sometimes but not regularly? Is it things that they're fidgety or they leave their seat or they're kind of restless, but that's appropriate for their age? So we'll talk through kind of what's typical and what's not, but these are typically the markers of the hyperactive impulsive presentation of ADHD. We also have the predominantly inattentive presentation of ADHD, which is actually the most common type of ADHD. This one is harder to identify as a lot of the symptoms of the inattentive presentation are more internalized rather than showing up externally. So it's things like daydreaming or difficulty holding attention, or maybe having trouble organizing, or has a hard time doing things that take a lot of mental effort, or is often forgetful. Those things are harder to see. But this type of ADHD is often or is the most diagnosed. And again, for kids up to age 16, we need to be seeing 6 or more of these symptoms. And for adults, we need to be seeing 5 or more of these symptoms. And then the last type of ADHD is the combined type. And that means that someone has met the symptom count for both types of ADHD, both that inattentive presentation and that hyperactive impulsive presentation. And with all 3 of these different types, we're looking for symptoms that are present for at least 6 months. They're not necessarily appropriate for the student's developmental level, and they are disruptive to their functioning and their ability to participate in social life, their schoolwork, their work outside of school, and they're also not better explained by a different type of mental disorder like anxiety. So there's a lot of criteria where many of us could identify with some of these symptoms at any one point across all 3 types of ADHD. But in order to really be diagnosed, we need to be seeing them consistently and across multiple settings and across a period of time. And again, they can't necessarily be developmentally appropriate. The prevalence of ADHD is around 8%. It's higher for boys than it is for girls. For boys, it's around 10%. For girls, it's around 5%. Most of that is because a lot of the studies that are done on ADHD and a lot of the research that has been done has been predominantly on male subjects throughout time. That's changing. We're getting more and more updated information about how ADHD presents in women and girls. But part of that too is that boys tend to show those more hyperactive impulsive symptoms that are easier to see. And girls tend to have more internalized symptoms that are harder to see or harder to identify, or are maybe more easily mixed up with a different disorder. So again, we want to remember that there's so much more to ADHD than this hyperactivity and this impulsivity. Often the hyperactive impulsive type gets referred more to because it's more disruptive. It's more disruptive to teachers. It's more disruptive to parents at home. And so there's more urgency sometimes to make that referral for testing because it's so disruptive. The less externalized symptoms of ADHD that many girls are experiencing aren't as disruptive, and they may be more prominent to the person experiencing them, but less prominent to the people around them. So I just wanted to give some examples of what some of those internalized symptoms that are harder to see might look like. It can be difficulty concentrating. It can be being forgetful. It can be getting bored easily or daydreaming. It can be experiencing anxiety. Sometimes it's hyperfocus. Sometimes it's perfectionism. Sometimes it's fidgeting, which isn't necessarily getting out of your seat and running around, but it is a form of kind of being a little bit more hyperactive, is having to constantly do something with your hands. Another thing that's important to note in terms of females versus males related to ADHD is that oftentimes girls are experiencing the perfectionism, the anxiety. They tend to be a little bit more people pleasing. So they're less likely to have those low grades due to ADHD. They often still get their homework done. They often still turn it in on time. They often still get good grades. But what teachers aren't seeing is that experience at home of how much more work they have to put in compared to their peers in order to complete that assignment, in order to get that A on that paper, in order to get it turned in on time. This can really increase risk of burnout. It can increase chances of low self-esteem. And oftentimes girls experience like, I know that I'm smart. Why is this so hard for me? I should be able to do this. Why can't I do it? The other thing to keep in mind, which I'm going to pass the baton over to Alaa in a moment, is that because these internalized symptoms are similar to other mental health disorders, ADHD can sometimes be misdiagnosed. And so we really want to make sure that we are diagnosing, and we're diagnosing the right challenge. Because if a student has anxiety, we don't want to be treating them for ADHD, and vice versa. We really want to get down to the nitty gritty of what's truly going on with this student. And then the last thing I wanted to mention is for those girls that are turning in their homework, they're getting those good grades, there often isn't necessarily going to be a referral made to special education or concerns brought up to parents about what's happening with this student, because from the teacher's perspective, they turned in their homework, they produced a good product, and they got a good grade. So this is really more difficult to see, especially if a student isn't talking about it. And it's often something parents will experience at home and maybe need to advocate for their student, and teachers aren't seeing it as much at school. So I'm going to pass the baton now over to Alaa to talk about the importance of getting that diagnosis.
Thanks, Meghan. So as Meghan was saying, a lot of the times students, especially when they're presenting as doing really well at school or doing really well at home, are often struggling internally. So the importance of making sure that we provide a diagnosis if there is one, or seek out an evaluation, is really to help decrease some of the risk that can be associated with unidentified ADHD. Unidentified ADHD meaning, hey, my kid is struggling, the student's struggling, but we're just not seeing it, or we just haven't gone through the processes needed to identify what it is. So a lot of the time students will start to feel like, hey, this is my fault. Something is wrong with me. I'm doing something wrong. Look at the other 20 kids in my classroom. They clearly are able to remember to turn in their homework. Their paper's not crumbled at the bottom of the backpack. It's nice and straight and clean. And so we start to see that impact on self-esteem. We start to see a decreased sense of success and expectations that we're just not going to do well. We might see some disengagement. We might see some negative impact on academics or social interactions, activities of daily living. So these are things like routines, bedtime routines, getting ready in the morning. Those are areas that we end up seeing difficulties, especially when we don't really understand what's going on. And so being able to provide that early and accurate diagnosis can help students feel empowered and understanding what their learning profiles are like, where they are showing strengths, which areas they need support in, and be able to feel that it's okay. that it's okay that this is something that's hard for me. I might need 2 reminders, and that's just the way that my brain works, and I don't have to feel like there's something internally wrong with me. It's also important to get early access to treatment options, whether that's through accommodations and interventions at school to help set themselves up for success later, right? To start build some of those skills that they need to stay organized, to build reminders for themselves, to help sustain attention. Providing parent education is really important, and helping parents understand, how do I navigate some of these difficulties that my child is going through, one, in a way that is productive, and two, in a way that makes me know that this isn't my child's fault, right? Why are they throwing tantrums at the end of the day every day? Well, now I understand why, and here's how I can support them. So that early access to diagnoses is important, because it can open up a pathway for getting these supports that the child needs to be successful in their environment. But how do we do that? How do we seek out those supports? What do I do, right? Hey, I'm starting to see some of these signs. I'm starting to see the impact of functioning, but where do I turn? There's so many different places that I can go. Really, your first step is to gather information. Where are you seeing the areas of difficulties? Is it just at home because they're successful at school, like the example Meghan gave with girls who are able to kind of get their homework done, and so at school they look like they're doing really well, teachers have no concerns? Is it the hyperactive impulsive kid who's really struggling across the board, whether it's during sports or outside extracurricular activities, school, or is it both, right? And so gathering information, and we'll talk a little bit more about that here in a second, is going to be a great first step. Talking to professionals in your environment. So your child's pediatrician is a great resource. And then knowing what type of evaluation to seek. Pediatricians are really great as kind of your first stop, go to when you're trying to gather information. They might be able to send out some screeners called Vanderbilt. They'll send them out to school and send them out to you as the parents to fill out. And they're really going to be a great resource for providing a referral. At times, those Vanderbilt rating scales may be enough, but as Meghan mentioned, there's so many comorbidities. There's so many times that behaviors look like ADHD, but may not be. And being able to truly identify what is the root cause of those difficulties that my child is experiencing is very, very important when we think about how do we treat those difficulties. So seeking out an evaluation is really what's going to be most helpful. What do I mean when I say evaluation? Well, a good evaluation is really going to help you understand your child's overall well-being. We, of course, don't function in a vacuum, right? We can't just look at behaviors and we ignore academics, or we can't just look at academics and not look into social emotional functioning like anxiety. So a good evaluation is really going to be comprehensive and help you understand your child's profile across the board. So they're going to help you understand how your child learns, what areas are their areas of strengths and what areas are areas for growth. Most evaluations will do those first top 2 things very well, as long as we seek out an appropriate evaluation, and they're all going to be pretty consistent. Where we're going to differ based on the type of evaluation is what are the conclusions that are drawn, what are the implications that are provided, and what are the treatment options that they're going to give you, the recommendations. So as a kind of a sneak preview here, if we're going through the school and doing a special education evaluation through the school, it's really going to focus on, is that child eligible for special education based on the categories provided? And does the child show an educational need? And then it's going to give you a list of recommendations and interventions that the school will be able to provide through what's called an individualized education program. Conversely, when we do a private evaluation, it's really going to focus more on diagnostics. So we're going to break that down here in a second. But as we're going through the different types of evaluations, I want you to think about some of the questions that I want parents to ask themselves when they're seeking out an evaluation. Going out and doing an evaluation just for the sake of it, for funsies, can be done. Would I ever recommend that we do that just to see where my child lands without any concerns? Not necessarily. It's a lot of work. It's a lot of time that they have to put in. And really, I kind of steer away from let's just do it just to see, unless we have an area of concern. Is there a referral concern? What is your child struggling with? Is it inattention? Is it hyperactivity? Is it academics? Who's observing those difficulties? Is it teacher and parents? Is it just you as the parent? Is it just during extracurricular activities? So we want to know, where are we seeing those difficulties? And then why are we seeking out an evaluation? Is it purely to identify supports for school, and the diagnosis maybe doesn't really matter as much at this point? Or is it really to get that diagnosis of ADHD, if that's what it is, and or rule out other comorbidities that are present? Those are the types of things we want to think about as we consider which type of evaluation we head into. Fun fact, sometimes it's not just one, right? Sometimes it's we want an outside clinical evaluation that'll give us that diagnostic information, and a school-based evaluation that then can give my child specific supports at school. And so keep that in mind as we go through them. So I'm going to review 3 specific types of evaluations here that can be completed. The first one I've called clinical evaluation, but I want you to think of it more broadly. This could be a neuropsychological evaluation. It could be sometimes called diagnostic evaluation. I've seen them called psychological evaluations. They're all essentially doing about the same thing, and they're addressing that referral concern. This is really what I see most of the time when we don't have some significant concerns related to academic testing. This is what you would typically want to seek out through kind of those bigger hospital settings. There are sometimes private practices that will provide it. And they're typically conducted by a licensed psychologist. It could be a neuropsychologist. It could be a clinical psychologist. It could be somebody with a PsyD, a doctorate in psychology versus a PhD. Could be an educational psychologist. But the key point here is that we're addressing a specific area of concern, typically not academics. They're looking holistically at the child, and typically it is covered by insurance if you're going through those bigger areas. The point here, though, is, again, academics isn't typically included because a lot of insurance companies will not cover academic testing. They're also very specific, so they're looking specifically at areas of concern. They may consult with other providers that the child's working with. I've seen them include teachers. I've seen some not include teachers, and they're really focused on giving you recommendations for treatments. These types of evaluations I recommend, especially if there are any neurological concerns like seizures, concussions. Working with a neuropsychologist is important in that setting. Conversely, I'm going to introduce you to a psychoeducational evaluation, where now we're really looking at all areas of concern. So it includes all those areas that I mentioned, but we're also looking at academic functioning. So here we're thoroughly looking at our reading skills, our writing skills, our math skills. And this is something that I highly recommend when we have concerns with ADHD, because difficulties that are related to ADHD not only impact your ability to learn, but also impact your ability to complete some of that academic work. So being able to write an essay requires planning, requires organization, requires reviewing, not rushing, right? There's so many areas that fall under that executive functioning umbrella that impact learning to write an essay. So being able to do a comprehensive evaluation that includes academic functioning can really help identify how those ADHD symptoms could be impacting your child's learning. So really looking very carefully at all the areas of functioning and how it could be impacted by executive functioning. These are again conducted outside of the school system with a licensed psychologist. Again, academic assessments are not covered by insurance. So a lot of the times these evaluations are private pay, although there are some insurances that'll cover after the fact, but that's really specific to each person's insurance specifically. They're always multi-informant. So parent report, teacher report, consultation with other providers like therapists, OT, PT, and really looking to understand full functioning for that student. The last type of evaluation I want to highlight for us today is a special education evaluation. Actually, let me take a step back here. I want to mention that a psychoeducational evaluation will provide recommendations for home. How do I support my kid at home? But also provide you with the information you need to advocate for your students that you're getting supports at school. So really walking you through and helping you kind of pick apart an IEP, considering special education, considering other types of supports, what are the accommodations that are recommended for school. So really breaking that down into those pieces of information. And the last one I want to talk about is now the special education evaluation. So this is the type of evaluation that you would oftentimes seek out through your child's school. If you're in a private school or you're in a homeschool setting, then the district in which either your home or your school is in is where you would still be able to access a special education evaluation and potential services if your child qualifies. So just because you attend a private school or are homeschooled still means that you can access these services if that's something that you're interested in. Just the way that you go about it is a little different. But these are the evaluations that are conducted in a school. They're conducted, the lead really is generally the school psychologist. So they're the person you would connect with in order to start an evaluation process or the consideration of an evaluation process. But really the evaluation is conducted as a team. So with a full team, it usually includes your child's teacher, a special education teacher, a case manager, an admissions person, an occupational therapist, the school psychologist, counselors if they're involved. So really it's looking at supporting the child with a team. And it's looking specifically at determining eligibility for special education. So this is the kids who are struggling in school, who are showing an educational need. They're falling behind in reading. Their grades are never, they're failing out of their classes. They can't get their homework turned in for middle school, high school. They're having trouble with organization. They're constantly losing their materials, and they have an educational need for support. They would go through this special education evaluation. It's not diagnostic by nature. So if you don't have a diagnosis of ADHD, but your child needs supports really only in that area because of organization, planning, time management, then in the state of Minnesota, a diagnosis of ADHD is required. So remember earlier I said, hey, there might be cases where you need both an outside evaluation and a school-based evaluation. This would be one of those cases. The special ed evaluation determines eligibility, like I said, for special education based on one of the 13 categories listed out under IDEA, the Individuals with Disabilities Education Act. And again, it's not diagnostic by nature. And the conclusions or the takeaways of that is really to guide the services that the child needs at school. So we're talking less about how do you support your kid at home and more about how do we support this child at school. It's at no cost to families. So this is something that's covered by the school and includes assessments in these areas that I've listed there. Executive functioning, so that's the areas of functioning that are impacted by ADHD, and Catherine will talk a little bit more about what they are and what they look like, are measured through a school-based evaluation. Oftentimes is through what we call indirect measures. So those are parent and teacher rating scales. Outside evaluations, like I described earlier, would use more direct assessments. So assessments that specifically looks at areas of functioning, like inhibition or controlling your impulses, or being flexible in your thinking. Schools aren't able to provide that level of detail. And so they really look more broadly at cognitive, academic, social, emotional, and so on. And they are multi-informant evaluation. I wanted to just talk a little bit more about what the supports look like after an IEP, because again, after a special education evaluation, because again, there are cases in which you're going to want to do both an evaluation with an outside provider, a licensed psychologist, and then also complete the special education evaluation. Most schools work together with the outside providers, so they won't require all their students to repeat testing. So if I were to work with students, say Ben, and I completed an evaluation, I looked at all the areas of functioning that a special education evaluation would do as well. So we're talking about all of these areas here. Then the school could do a review. So we wouldn't want to go put the student through all that testing again. And then they would make their determination. And then they would that evaluation would help determine how do we best support that student at school. Sometimes it's not an IEP, right? Sometimes parents come in and say, hey, I want an IEP, but that's not the best way to support their kid. And sometimes they come in saying, hey, I want a 504 plan, but the school says, let's talk about an IEP. How do you know? How do you know? And how do you approach the school? One thing you want to do is just be a little bit more knowledgeable and understanding how those two different supports help support students. So I just wanted to spend a minute talking a little bit about the difference between an accommodation plan and an IEP. I want to start with the accommodation plan. So an accommodation plan is really something that can be put in place for students who are struggling because of a disability that limits one or more of their major life events. So, and my major life event, there's plenty of examples. Some include learning, seeing, hearing, organizing, planning. So a kid with ADHD, say, is struggling with accessing their academics because they're a little bit distracted, they're fidgety, they have a hard time getting started on tasks, and it's impacting their test taking skills because they can't just sit through an entire test, or they don't finish it in time because they zone out. So in this example, we have a student with a disability, ADHD, who's struggling in one or more of their major life events. So accommodations can be put in place to help that student access instruction. So it could be sending notes home from class to help the parents review that information with the student, or to reduce the load of having to write the notes down and focus more on the class. Could be frequent checks with that student. Could be asking that students to repeat the directions to make sure that they've heard and process those directions. Could be giving them extended time for testing. So those are all accommodations that can be put in place to help that student access the instruction. What an accommodation plan is not going to do for your kid is give you individualized teaching. The teaching that's going to happen is going to be the same as everybody else, but they're going to help you access that instruction. An individualized education program, however, an IEP, allows your student to get more specialized instruction in the areas of need. So this is a kid, to give you an example, who is struggling with hyperactivity, impulsivity, inattention, and it's impacting their ability to learn to read. So now they're very behind compared to their peers. So we're still working on CBC, but really my class is working on reading fluency. So my students still working on decoding simple words. Everybody else is really kind of more moved on into reading fluency, for example. So that kid might qualify for an IEP where they're going to get those individualized supports in reading, where they work not only with their classroom teacher, but with a special education teacher as well, to get additional instruction in their area of need for reading. And we're going to give that same student accommodations. So they're going to get extended time for testing, support with reading questions when needed, and we maybe even give them access to assistive technology, like accessing audiobooks instead of being expected to read a textbook on your own. Those are the types of services that you would get through that IEP. There are some links here that once you get we'll have a copy of the slides that for you sent to you. These are all live links that you can click on to get more information on the differences between IEP and a 504, some accommodations ideas, and the Minnesota Manual for Accommodations. And then I just have a slide here that provides examples of what accommodations can look like depending on what the areas of needs are. So falling behind during class discussion, what we would want for that child is to learn how to ask questions to encourage participation, or to have the teacher be aware of that and just be directing some of those questions towards that child. So those are some really good accommodations that can be set up for students who are struggling with executive functioning. And with that, I'm going to turn it over to Catherine, where she can provide a little bit more information on now how do you support your student at home.
Thank you. So we wanted to wrap up today with some tangible takeaways for you guys to support your students as you're navigating this journey and supporting your students with ADHD. So the first thing that we want to highlight is that the best thing that you can be doing as you parent your student with ADHD is to educate yourself and learn more and immerse yourself in the resources that are out there for supporting students with ADHD. As you learn more and spend time diving into resources, it really builds your empathy for your student. So, and in the past, things that you may have noticed or started to think about as a behavior, or you're a student being lazy or defiant, you start to see it from a different perspective and understand that these challenges that your student is showing up with is coming from a place of a skill deficit or a area that they're still learning and growing in. So really being able to see them from that perspective and brings that empathy to your family as you navigate this journey. As you dive into these educational resources as well, it also provides you with tools to equip yourself to set up your family systems and your environment at home to give your student some support and an environment where they can really thrive. So you're by being here, you're doing exactly this. You're learning more about how to help your student, and that is an awesome first step. So we're super happy to have you and be a part of this journey with you guys. On this slide here, there are a couple websites and books that are great resources for you to continue diving into. And then at the end of the slide, there's even more books and video links and resources. So definitely use these as next steps as you're looking to kind of dive in and see what other information is out there for supporting your students. Another thing that's really helpful when supporting and parenting your students with ADHD is understanding this concept of executive functioning. So, executive functioning skills are the prefrontal cortex, the part of your brain that is like the conductor of the orchestra or the CEO of the company. And these are the skills that help us get stuff done. So you can see them listed over on the side here. They're really important. They're used for everything. So whether your student is at basketball practice or getting ready for bed at night, they are using multiple executive functioning skills all the time. And if you are parenting a student who has ADHD, it's really helpful to come at it from this perspective of understanding that individuals with ADHD have about a 3-year delay in their executive functioning skills. So if you have a 5th grader who has ADHD, their executive functioning skills may be presenting closer to that of a 2nd grader. And this is really important because when we think about setting expectations or setting up just our family systems, we want to make sure that we are asking our students and our kids to do things that they are capable of doing independently. And at first, this might be with that 3-year delay than what we would maybe expect from that executive functioning perspective. It doesn't mean that they're always going to be 3 years behind. So we want to point out that maybe right now, if you're at the beginning of this journey, that is true for your student and your family. And then as you continue to build in more supports and interventions, maybe navigating if medication is a piece of the puzzle that supports your student, that gap will begin to close and you can see an improvement in executive functioning skills. But when we're at the beginning of this journey, we want to make sure that we are setting our students up for success and having expectations that are in line with what they are capable or independently able of doing. And I like to point out too here that this really helps our students feel successful. So when they are asked to do something that's within their realm of capabilities, that feels really good. They are able to finish the task, do it once, do it well, and feel those moments of success, which then snowballs into that positive sense of self. And from your perspective as the parents, we also want to see our kids be successful, right? So when we see like, hey, I asked them to do this, they were able to do it, they were excited. That felt really good for me because I wasn't having to nag or repeat myself a bunch. So it really has positive impacts on both the parents and the students. And then we can build from there. Once they're at a place where they're independently doing 1 or 2 steps directions at a time, let's build once they have more skills and tools in their toolbox. Building routines is another thing that we can be doing as parents as we're beginning this journey of navigating and supporting our students with ADHD. So why is this important? Routines are helpful because it creates a sense of predictability for our students with ADHD. So instead of every morning waking up and being like, I don't know what time I'm going to leave the house today. I'm not sure if I have to take the bus or if mom's going to drive me. I don't know if my homework's already in my backpack or not. that creates a lot of stress and uncertainty from the student's perspective. So when we can build routines and predictability, it takes some of those unknowns away and creates more automatic processes that the student doesn't have to stop and think really deeply about every step along the way. We know that individuals who have ADHD oftentimes have working memory difficulties. And working memory is our ability to hold information in our mind while we're doing something with it. So let's think about the example of coming home from school and that transition back home at the end of the school day. If the parent says, all right, honey, we're going to go get inside. I want you to empty your lunchbox into the sink. And then can you take the dog out really quick? And after that, we're going to get started on your math homework. Those are 3 things that the student has to remember in their mind as they're working through the steps. So maybe they get through and they empty their lunchbox in the sink, and now they get to the spot where they can't remember what the next steps were. That can be that stress and anxiety producing experience for the student. They might feel shame around not remembering what they have to do next. We might see behaviors come out in this point of the process because they are attention seeking to distract from the fact that they don't remember what to do next. Or we might just see that they're like, I don't know what I was supposed to do next. So they go and they turn on the TV and do something completely different because they can't remember the rest of the steps. On the flip side, when we build routines into these systems, it creates more automaticity within that part of the day. So instead of your student having to remember the first, second, and third thing, and it might be different every single day, we create that automatic system so they always know when I get home, first I empty my lunchbox into the sink, then I take the dog out, and then I have to sit home and do my homework. How do we do this though, right? It sounds great, but how do we make this happen into our lives? My number 1 recommendation is to keep it simple. As parents and for the students, we are going to be much more consistent with following through and doing it every day if it's simple and easy for us to do. And consistency is that second important piece. We as the parents or the adults in the student's life are in the driver's seat for the beginning of this journey. And when we are able to be consistent, that benefits our students because then they have that repetition and they know what to expect. So building those routines into your family, keeping it simple, being consistent, and then using visuals. Anytime we can have a visual checklist or something with a visual component is going to benefit your students with ADHD. One part of it is that working memory piece. For those times when they can't remember what step comes next, they have a place to consult and see so that they can have a reminder or find that answer independently without having to rely back to asking you, whoever gave the direction. The other piece is it adds some excitement. If they can see a picture of them with their backpack on or with all the materials they need to get out the door, that creates a sense of relatability. And again, that piece where they can do some self-monitoring and see, okay, this is what the visual looks like. Do I match this? Do I have everything I need? Did I get all of this stuff? So it's one extra level of support to increase your students' independence. And then anytime we're able to bring the child into developing these routines is going to be encouraged because it feels a little bit less like we are just telling them what to do at all points of the day, and it gives them a little bit more say into how do you like to structure your time after school? Do you like to get a snack first, or do you like to walk the dog first? So anytime that's an option, it's definitely encouraged. And we acknowledge that there are times where there's some non-negotiables. Like we just have to do these 3 things before we get ready for bed. And so it doesn't mean the kid gets to have a say in all of it, but just being mindful of incorporating them into these processes when it feels like it fits for your family. Individuals with ADHD oftentimes have a some challenges with their concepts of time. So we're going to talk through a couple different ways that this can show up just to build your empathy and awareness into understanding how your students and children with ADHD might be processing and conceptualizing time. So the first one I want to talk about is time horizons. This is how far in advance something is happening before it really feels urgent to the individual. And this develops over time. So as we're younger, our time horizons are like, this is a now or a not now problem. And then as we get older, we are able to plan and view a little bit further and further into the future to help us prepare ahead of time. And then when we have an individual with ADHD, those time horizons are even shorter. So for that high school student who typically we're thinking like 3 days in the future is a time horizon, if they have ADHD, it's more like 1 to 2 days. So this is part of what's happening for individuals where they're like, I don't feel pressure to do my writing assignment until the night before it's due. I know it's happening. I know it's due. I know it exists out there, but I don't feel the urgency to sit down and do it until that night beforehand. This is part of what's going on in those situations. And then kind of to build off of that is this idea of being able to estimate how long something is going to take us. So if our time horizons are shorter or a little bit off, that also trickles into our ability to estimate or figure out how long something is going to take us. And when I work with students in ADHD and executive functioning coaching sessions, I will often do some time estimation activities with them. So I'll just say, let's go through a list of random tasks, and I want you to guess how long it's going to take you. So I had one student recently, she was in 9th grade, and we were estimating how long it took to blow up and tie a balloon. And her estimation was 5 minutes. And so then I said, okay, here's your balloon. Give it a go. I'm going to start your timer and we'll see how long it actually takes you. And so we start the timer, it's sitting on the table, and she starts blowing up the balloon. And within like 15 seconds, you can see her eyes looking on the timer, like, uh-oh, I don't know how I can drag this out to last 5 minutes because I'm already done blowing up my balloon and it's only been like 30 seconds. So we had her stop, we tied the balloon, we talked about it. And this is really important because if we have a student who is chronically overestimating, like that example, they're like, oh my gosh, that's going to take me so long. That creates this sense of overwhelm and like these mountains that we're like, I'm never going to be able to get through that. And maybe that's not even true. It's going to take a lot less than they're thinking it will. And then on the flip side, if we have a student who says, oh, that'll take 5 minutes, no biggie, and it actually might take them closer to an hour, now we're creating some inconsistencies with how much time we need to set aside in order to complete a task or an assignment without having to rush or turn something in late. So this is a really crucial skill. And so being able to understand how our students might be processing and like feeling that time helps us with supporting and setting up supports to help them tie and connect their sense of time. And one way to do this is to make time visible. So using an analog clock whenever possible over a digital clock is one small, easy step we can be doing to help support our students with being able to see the passage of time. When we have the minute hand swipe through the clock, that gives us a visual to connect with. What is 15 minutes? So instead of just saying 15 minutes and having no physical sensation of what that is, we're now able to see, okay, the minute hand was here. I can kind of check periodically as we go. And then once it gets here, then I know the time has passed. This picture on the board or on the screen takes it one step further. And this is a tool called the working clock, where we can add colored sections into an analog clock to help with transitions or checklists or routines. So the example you see here, this would be like if we are getting home from school at the end of the day and we say, all right, when you get inside, I just want you to get yourself ready. We got to put our backpack away, go to the bathroom and grab our snack. And we have like 7 minutes to do that. Then we're going to move into homework time. So the purple section, that means we're working on homework. And once we've done homework for about 25 minutes, then you get to watch one episode of TV. And now the student is able to see when they're in the get ready section, when they're in the homework section, and when they're in the TV section. And I have found that this type of visual significantly reduces the types of questions like how much longer? Is it time to do homework yet? When do I get to be done with this? What am I doing next? Because we've created this visual to help them see and understand how time is passing as they have specific tasks on their to-do list.
And I just want to quick add that clock is just a clock that you can get on Amazon. It has a glass face. They're like 10 to 15 bucks, and you can draw on it with just a regular whiteboard marker. So it's not any kind of fancy supplies that you need to have. You can do it over and over again. It erases easily. And Catherine mentioned this is called the working clock. This concept comes from someone named Sarah Ward. She's a speech language pathologist who specializes in executive functioning, has a lot of great resources, webinars, tips, and there's some information on her website more about the working clock if that's something you're interested in digging into.
Thank you. And then we just want to end today with this idea of giving our students as much positive feedback as we can. We know that students with ADHD tend to receive more negative feedback throughout the day than their classmates. They're hearing things like, pay attention, sit down, put your pencil away, stop touching your neighbor, have you gotten started yet? And after a while, like that takes a toll on them. That feels really hard to always be hearing about the ways that they aren't meeting expectations. So as adults and caregivers in these students' lives, we want to give our children with ADHD as much positive feedback as we can. Ideally, we're giving 3 to 5 positive statements about what they're doing well for every one reminder or negative comment about behavior. Anytime they're not engaging in the disruptive or off-task behavior is an opportunity for us to point it out. I love how you're sitting here with us at the dinner table right now. Thank you so much for getting that backpack hung up on the hook. I really appreciate it. Every little time we can point it out and give that feedback to them goes such a long way for these students building their sense of self and their self-esteem within their day. There are times when we have to build in some motivators or reinforcements, of course. And when we do that, anytime we can say, when you do X, you can earn Y, is going to be much more received than when we're trying to take something away. If you don't turn your homework in, you can't have your iPad. It kind of goes along that same framework of building in positivity, being a supportive piece of your students' team. And then again, building in choice. When they're able to choose, what is it that I want to earn or work towards, there will be more buy-in and more positivity around that process than us just picking something for the student that we think they might be motivated by. So here at the end, there are a couple slides with lists of other books and resources. The next one has video links, both for parents as well as videos and links if you are navigating these conversations with your student or child around what does ADHD mean for them. So check these out and continue just gathering as much information and resources as you can as you support your students. And then for Grove's Learning Organization, we do also provide a plethora of services designed to support your students with ADHD. So this slide highlights some of those resources and services that are available for you at Grove's.
I think now we're going to open it up to if anybody has questions in the chat. I did see one question that came in. It says, when you have both an outside private evaluation and a school evaluation completed, do they have to be completed within a certain amount of time of one another to ensure, or do we need to ensure that the same testing instruments are not used in both environments? So that's a good one for Ella.
This is an excellent question. So there's two parts to this question, right? There's the timing component and there's the instrument used. The timing component is really going to vary by domain. So for example, cognitive assessments, really, one, they shouldn't be repeated within a year. And two, there's usually not a reason to repeat it more often anyway. And so if I was receiving an evaluation and it had a results from another evaluation where cognitive learning IQ was already assessed, it looked good, I don't have any concerns, I probably wouldn't repeat it until it was about 3 years old. Academic testing, on the other hand, would be updated. And I'd recommend we update it maybe every year or so, because kids' academic skills change over time, right? That's what we want to see, is we want to track that growth. And by updating something that's about a year old, it's a good time to say, okay, how far up, how much growth has happened. Really, this is my recommendation only in the case where you're looking to do a special education evaluation after you've done a clinical evaluation. So that kind of answers that question. In terms of instruments, yes, there are guidelines for when an instrument should and should not be repeated. So those that are sensitive to what's called the practice effect should not be repeated within a shorter amount of time. So for cognitive testing, I wouldn't want to repeat anything that's less than a year old. I would likely see inflation in scores, which would make it look like, there was a lot of growth in those areas, but it's more just that practice effect. For academics, that time is shorter. And so I could potentially use the same assessment depending on which one was used, within 6 months or 7 months or 8 months. However, there are plenty of options available. So most schools would have access to something different if they needed it. In my experience, if we get an evaluation at school where it's within a year, it's unlikely that I'd want any of it repeated anyway, as long as, again, it provides a valid understanding or a good, accurate understanding of that child's profile. Now, if the question had been, I'm just going to throw this out there, when do I repeat an evaluation? Like, I did a clinical evaluation. I learned that my child has ADHD. Do I need to repeat it at any point in time? And my answer is yes. Typically, I recommend that we do an updated evaluation every 2 to 4 years or so, really thinking about big moments of transition for that child. So going from middle school to high school, do we still have the appropriate accommodations in place for that child? Do we need to update their accommodation plan because things have changed? Do we need to remove any individualized services because really he or she is performing at the level that we want them to, and we want to make sure that they're staying in their least restrictive environment or staying in their general education classroom as much as possible. So there's definitely reason we want to update. Maybe they're going into college, and before we want them to go off into college, we want to have most updated testing. So those would be great times to update an evaluation.
And I just want to highlight here the importance of, if you've had testing done privately or in the school and you're going to do it in the other environment, we need those documents to be shared between the two places, so that we are not repeating assessments that shouldn't be repeated in a certain time frame. And the practitioner in each of those settings will be the one to help determine which assessments should be given based on what's been given previously. There may be cases where a family is seeking like a second opinion because they are wondering about the results of the previous assessment or something like that. We still want to see that previous assessment. We may still be able to assess similar skills if we're questioning the results of the previous assessment, but we would use a different test in order to eliminate those practice effects. So I know sometimes as a family, it's tempting to not want to share because you want a second opinion, you don't want any preconceived notions, but it's really important to share that information with both settings so that we can make sure that the testing that we're doing is accurate and done with fidelity and is not being affected by those practice effects.
Super helpful. Oh, thank you, Ella, Catherine, and Megan. You three are amazing, and I learn something new every time I hear you present. I think we are up at the hour. I'll watch the chat for just a moment, but in the meantime, we're just so thrilled and appreciative of everybody who attended today. As a reminder, this presentation will be shared with you via email in the next few days, and will also be posted on our website. So we encourage you all to share this information with your friends and family. We're very grateful to be a part of this community resource, and we encourage you to reach out if you have any questions. You can be of support. So again, thank you to our presenters, and thank you to all who attended. And I hope you have all a great day. Thank you.
Thanks, everybody.